So we want to thank AMT again. They are a very valued member partner of the NCHSE. They were with us at our conference in Seattle, Washington. We're next year in Phoenix, Arizona. So we're very excited about that. And we look forward to hearing from Mary and her friend Nancy, not to be confused with our executive director, Nancy Allen. So the other Nancy from AMT. We look forward to having them tell us about how we can evaluate credentials. So Mary, we'll turn it over to you.
Thank you so much, Karen. And one of the things that I'm grateful for are the students. We know Westmac, and they are what gives us energy in life. And so I'm very delighted that that group is here as well. So I will dive right in. Welcome to our webinar, How to Evaluate a Credential. And this is about AMT support for health science educators. So I'm happy to be here on behalf of AMT. AMT is an acronym for American Medical Technologists, and we're a not-for-profit certifying agency and professional organization of allied health professionals. And AMT is all about getting qualified professionals into entry-level roles in healthcare as our health science educators. And I'd like to show how our missions align along with what we have to offer to support you in your work. And ideally, what you'll find at the end of our time together is resources that you can tap into to help your students immediately and further down the road as they start careers. And that help would include competencies for professionals, certification information, and some details about a new HOSA competition. I'm going to begin with the current state of healthcare and then very quickly drill down to where we can all play a role in filling some of the current gaps. And that would be gaps in healthcare delivery, gaps in meaningful jobs in an entry level, and gaps in quality. And thinking in new and innovative ways to get there. There are critical staffing shortages. There are viable solutions. And quality is really crucial for success. We're here to help. And then we'll have time to answer your questions. And also at the close, I'm going to offer some contact information for AMT so you can reach out and ask questions if you think of some later. AMT is engaged with National Consortium of Health Science Educators on a few levels. First is that both the NCHSE and AMT are laser focused on career success for health professionals. And both organizations come at it from different angles. NCHSE is educators and AMT supports that work. And we've also supported NCHSE for years in that our AMT Executive Director, Kathy Spilia, represents national professional associations at an executive level for NCHSE. And even if you are familiar with AMT, you might not see the range of AMT efforts to advance the mission of professional excellence in allied health. Here's a list of partnerships with nonprofit professional organizations like yours. And also AMT's been involved with advocacy for the industry in terms of lawmaking, industry guidelines, publishing editorials, and individual member support for many decades. We also partner with educators at every level, as well as with health employers across the country. And all this outreach is related to the work that we do for future health professionals. What is the work that we contribute to further that mission? Well, AMT was founded, like many nonprofit associations, by practitioners who wanted to standardize quality in the field of allied health. So AMT sets standards for competencies of allied health professionals. That's what we do. And part of the standardization process is certifying individuals. And it's what we've done for more than 80 years. We offer 11 allied health certifications, medical, dental, lab, and an allied health instructor. And today, AMT is certification and professional membership association of well over 100,000 healthcare professionals. AMT is expertise and competencies, which is expressed in our professional certification. So what is the fundamental purpose of a certification credential? Well, we say it is objective third-party evidence that an individual possesses baseline competencies to perform a job. And they are awarded by an academic institution or by a recognized professional organization. And what they are is to verify qualifications and competence. And they also attest to a formal process and successful completion of specific criteria. And credentials are also important to give a trusted measure of professional credibility to the public. Once they're earned, the designated letters of someone's credentials can be placed after their name, but it's more than just 3 letters. When there's a set of letters in parentheses after the credential, that signifies the credentialing organization. So in the example of Chantal Williams, RMA stands for Registered Medical Assistant, and AMT is American Medical Technologists. So in this case, AMT stands behind the credential. So we've established that our joint missions are launching competent professionals into career success. Hopefully that is the aim of our students. But we also have a shared problem in the issues that are facing healthcare, and really no one is untouched by these. So it's likely we're all aware of staffing shortages in healthcare, but the scope is still surprising. U.S. Bureau of Labor Statistics indicates there'll be approximately 2 million openings in healthcare every year until 2031. Overall employment in these roles is set to grow 40% in that time, which is much faster than the average for all other occupations. The U.S. is going to need an additional 98,000 medical and lab technologists and technicians by 2025. Which is right around the corner. And hospitals have turned over 100% of their staff in the last 5 years. Allied health workers are key to this because they make up about 60% of the 10.5 million healthcare workforce in the US. And what the big numbers mean on a human level is longer patient waits for care, or worse, limited access to care for the most vulnerable. Some of the factors in staffing shortages we witness ourselves. Individual practitioners, we all have relatives or friends who've worked in healthcare and have seen retirement and aging out. During COVID, especially, we saw the impact of burnout. There's some big societal and industrial changes with the aging baby boomer population. Seniors see healthcare practitioners 4 times more often than younger people, so more people need to be seen. There's an increase in diagnostic testing. Labs are performing more tests and new tests. You know, there's the prevalence of chronic diseases like diabetes. And then there's advances in medical technology, which means more specialized knowledge is required. Now there are answers to our shared problems. We're seeing innovative solutions to staffing shortages, and of course, you're part of that. The expansion of career and technical education programs. That means there's 12.3 million students currently enrolled in CTE programs across the country. And state and federal funding is fueling some of that. Healthcare systems, they're implementing workforce development and apprenticeship programs, and we're really seeing those ramp up. They're building their own pipeline of workers from within, or they're partnering with local schools and online programs. Labs are upskilling workers and they're certifying new staff. A growing list of associations and companies are offering industry recognized credentials, certificates, and certifications. And this is all great. Industries are coming together to solve the problem. However, does your program align not only with the issues, but the priorities as well? Well, what are the priorities of providers beyond the workforce shortage? In hospitals, quality gets paid. The biggest payer is CMS, and the payment models they attach both incentives and disincentives for quality of care. And that's key for hospitals and for patients. Quality is assessed by patient outcomes and by patient experience, which is measured by patient surveys. A large portion of that measurement is responsiveness of staff, getting discharge information, and communication of staff, which is why properly trained and qualified healthcare workers are crucial. It ensures high quality patient care, and it reduces the time needed to onboard and to train. And well-qualified staff means responsibilities are covered competently. There are no shortcuts in patient care. So what's critical for success, of course, is making sure that the solutions we're providing are filling the needs of our healthcare employers. They need to fill jobs with qualified professionals. And since those providers get reimbursed based on services and quality, employees have to be well prepared and meet the industry standards. And then for success in meeting those standards, CTE programs have to be rigorous, have to be relevant to the job role, have hands-on training, and then effectively place graduates in the roles that they trained for. A good certification also has these characteristics. But how do you know if a certification credential carries those qualities? So this slide is an inside look at how to assess the quality of a certification credential. And we say there's 3 essential components, the 3 E's of certification. It's education, experience, and examination. Education is answering the question of whether the candidate received the proper training in the tasks required for practice. The experience has to be appropriate and sufficient to function in the profession. And the examination means the candidate has been tested on knowledge to further demonstrate some command of the competencies that are required for practice. So it's not just the test. The test is only one indicator of competence and should be used in conjunction with the other indicators of achievement or mastery in the credentialing process. So in order to earn any AMT credential, someone has to meet our eligibility requirements for education, plus have practical experience, plus pass a rigorous exam. Another important aspect of quality is security around that exam. Certification exams should be held at a secure site using secure processes, which maintains the integrity of the testing results. Another aspect of security of the exam process is whether there's third-party administration of the exam. It should be by someone who's not part of the credentialing organization, which ensures that the certificant passed the test unassisted. Test security is an essential element for the validity of an assessment, in addition to ensuring the protection of intellectual property. Why is security necessary for validity? Well, if a full exam is publicly available through a breach in security, candidates could easily learn the answers to all the questions, making the test invalid. And as a result, the safety of patients or the public could be jeopardized because the persons who believe to possess a certain ability by virtue of their credential may not be qualified. Think about a person drawing blood who doesn't know how to locate a vein for the procedure. We also want a fair process so all the exam takers have the same opportunity to succeed. And maintaining the integrity of the exam reflects well on those who take it. In my organization, it also protects the value of the certification for our current members and our future members. So what's at risk? Security matters to employers. They're looking for a trusted certification among their staff members because it has a direct impact on the quality of patient care. And then this graphic shows the level of security around an exam. It depends on what's at stake. And credentialing tests like licensure and certification are considered high stakes tests. Another consideration around exam security is the number of times that an applicant is allowed to sit for the same exam. Are they allowed to take it as many times as it takes to pass? Some are unlimited. A credible organization is going to limit attempts to a reasonable 4 tries. What I'm trying to convey is how quality matters to healthcare providers and how AMT is committed to quality in all that we offer. And now I'd like to share some resources from AMT that are all about preparing the next generation of allied health professionals. So competencies in the real world is the basis of a certification credential. And this image of excellent patient care that's displayed here exemplifies the value behind a worthy certification. The mission is to serve public health by using best practices to certify that health professionals are competent for their specific role. They've met the rigorous criteria, they've proved that they can perform relevant on-the-job tasks. It's important to employers, it's very important to the health professionals themselves, and perhaps mostly important to patients. And AMT dedicates significant resources to ensure that the competencies that are included in certification tests are based on practical and real-world work. So competencies are essential tasks and knowledge. And the competencies that AMT has set for various job roles in allied health are contained in our exam content outlines. And this is a resource I think is too often overlooked because it's somewhat humble and unassuming looking, but it's really a treasure trove of information. An exam content outline lists all the tasks and knowledge that one is tested on for certification. It can be a very thorough source of what the job entails. For phlebotomy, it's 4 pages of specifics. Each exam content outline is divided into work areas that are associated with that job role. For phlebotomy, for example, the work areas are obtaining blood samples, specimen collection and processing, time management, professional communication, clerical skills, safety, legal and ethical, medical terminology, anatomy and physiology. Everything involved in being a professional. And because it's for our exam, it also displays the number of exam questions and the weighting for the exam. But it can also be a great teaching and curriculum resource. I pulled out one example of a set for you, specimen collection and processing, and this is just to show you the level of detail. And behind each of these details is a great deal of research and experience. All the competencies are based on research in the field. They're vetted by working subject matter experts and continually reviewed and refined. Also in that document, you might find the references helpful when you're looking for a top-notch industry standard resource. These are lists of references and standards. They're vetted, they're extremely helpful. The published standards are fundamental guidance for professionals in the industry. And all these recommended sources can be downloaded at no cost from AmericanMedTech.org. And all these very detailed lists of competencies are available for each of these certifications. I've used phlebotomy as an example. If your interest goes beyond phlebotomy, I encourage you to explore these other job roles. CTE level jobs include medical assistant, I would say patient care technician, dental assistant, lab assistant, and administrative specialist. Higher level certifications for the medical laboratory require a full undergrad degree, but they can start as lab assistants and technicians as well as phlebotomists. So I'm going to switch gears a little bit, but another supportive offer from AMT for our stakeholders is a new initiative that we're excited about, and that is sponsoring a new HOSA phlebotomy competition. So out of the job roles in allied health, you might be wondering why we chose to focus on phlebotomy. Well, it's an important practice, certainly part of medical assisting as well. And we think it's an excellent entry point into providing clinical care. And here's why it matters in healthcare. Providers rely on accurate information from those collected samples in order to diagnose patients and treat patients. As I mentioned earlier, our aging population needs more medical attention. There's a rise in chronic diseases that requires ongoing monitoring, including diagnostic testing. Blood samples are also used to advance development of new treatments and new medications. And the expansion of telemedicine is really driving the need for remote diagnostic testing. If your students choose to learn phlebotomy, they can be part of a critical service in healthcare. So phlebotomy is important, but what's the day-to-day work like? These are the essential tasks of a phlebotomy tech. Drawing blood from patients or blood donors. They need to explain their work to help relax patients or donors who feel nervous. They need to verify a patient's or a donor's identity. Label the collected blood for testing or processing. Label sterile containers for other samples such as urine and instruct patients. They also enter sample information into a database. They'll use the electronic health record. Phlebotomists have to be able to assemble, maintain, and dispose of medical instruments, and then keep work areas sanitary. So we shared the positives of being a phlebotomist, but like any important work, it certainly has its challenges. Phlebotomists work a healthcare delivery schedule that can include nights, weekends, and holidays. They can be long days with lots of standing. They may be exposed to pathogens and needle stick injuries. Blood can contain infectious organisms, so they need to wear proper protective gears, gloves, and masks. And sometimes patients are hard sticks with hard to find or rolling veins. And not every patient interaction will be pleasant. Sometimes patients are unwell or they're upset by waiting or just impolite. Part of the training is not to take rudeness personally. There are some misconceptions about phlebotomy. Some might think that phlebotomy is basic or an easy skill that most people can perform. The reality is that phlebotomy requires accuracy and skill. It might look easy to stick a needle in a vein. However, only a properly trained phlebotomist can recognize and prevent the circumstances that can cause injury, inaccurate samples, or the mismanagement of patients or samples. So I shared some positives and challenges about the job of phlebotomy technician. And here's why students might find it of interest as they consider entering healthcare work. It can be a great starting point for a career in the medical field. Phlebotomists work directly with patients in a variety of settings. Training is typically less than 1 year for certification. And median annual wage back in 2021 was about $37,000. I did a quick search for jobs on Indeed, and one of my local large health systems is offering a $3,000 signing bonus for phlebotomy. They are in demand. So hopefully you see value in helping some of your students learn phlebotomy. AMT is very committed to encouraging entry in the field. As a certification agency and membership organization for phlebotomy technicians, we're proud to be sponsoring the HOSA phlebotomy competition. AMT first sponsored a workshop earlier this year at the HOSA International Leadership Conference, which was in Texas. We learned about HOSA and competitions. We had some fun. We were assisted by committed educators and some experts who are pictured here. And the best part is the room was at overflow capacity because of enthusiasm for the subject by HOSA participants. The goal of the competition is to introduce students to the medical discipline of phlebotomy and help them understand the role of a technician. They participate, they'll get hands-on experience, interact with patients, learn about professionalism. And we want to inspire them to use critical thinking skills and to be equipped to treat patients in a clinical setting. And because phlebotomy is a practice, to prepare for competition, students will have the chance to identify veins, stick needles into training arms, and draw fake blood. And of course, all body fluids would be simulated. If you're not familiar with HOSA, here's a simple description. It's 2 rounds of events. Round 1 is a written multiple choice test. Top scoring competitors advance to round 2 for the skills assessment. And then individuals move through the competition from local and regional, state to the international competition at HOSA conference in June 2024. In addition to HOSA awards, AMT will provide awards for top scorers. And because HOSA is a large organization, you'll need to understand your own local requirement for progressing through the competition. For the assessments, round 1 written test is going to include these topics. Students could expect 50 multiple choice test items, which must be completed in 60 minutes. Here's a couple of example questions that a student might expect to see on a written portion. Which of the following veins would be last choice for venipuncture due to being close to the median nerve and the brachial artery? And which of the following tubes would you invert gently 6 to 8 times immediately after the blood draw? And I have the answers. First one is B, and the second one is D, lavender. The hands-on skills assessment are a series of timed tests. Students have to demonstrate they can complete the skill accurately within the allotted time. And these times vary from 2 minutes for applying a tourniquet to 10 minutes for a routine ETS venipuncture that shows understanding of the order of draw. And by the time they get to competition, they'll know what ETS stands for and what we mean by order of draw. And I'll share a couple of examples of skills and assessment sheets so you can have an idea of what's expected. This is an example skill assessment sheet, and all these skill assessments can be found in the HOSA event guidelines. You can download these to see the possible judging points. In this case, ETS venipuncture is assessed on 44 steps with 75 points. And they're all listed on the skills sheets that I've displayed here. And by the way, ETS stands for evacuated tube system. Another example is a skill sheet for a 24-hour urine collection. Sometimes people are surprised to learn that phlebotomy includes collection of urine specimens, not just blood, but a high level of detail and precision is necessary for urine specimen collection too. Skill sheet's very detailed, so you'll know what you'll be evaluated on. And a final example is heel puncture. It's another important task that's assigned to the phlebotomist. Newborns are patients too, and collecting a specimen often requires doing a heel puncture. And we don't present these examples to intimidate students, but really on the contrary, by studying and preparing, they'll know how to appropriately respond with competence, not fear. They'll be ready when faced with common situations such as fainting patients and collecting a specimen from an infant, because those are patients who need the help that testing can provide. So ideally, your students will be excited about the challenges and rewards of phlebotomy. And so now, how do you help them to prepare to succeed at phlebotomy competition? Here's some helpful information and training materials to get you there. I'd recommend that you start at the webpage that AMT has set up. AMT is the sponsoring organization and has published some specific details you'll need to know about the competition tests, including all those skills that students will be assessed on. On this page is where you find detailed information about textbooks and hands-on resources, links to the HOSA competition, and the rules. Specifically, there's 2 recommended textbooks by phlebotomy experts from independent publishers, and you can find links to purchase these texts from the page on the AMT website. Students can also find these maybe through the library, or they can buy them used on Amazon. And you'll also find links to readily available practice materials from a mix of accessible online shopping sites. This is all independent from AMT. These are a variety of practice materials, so you can browse and see what you might need for your own purposes. And you can use this QR code to get to the AMT HOSA page where all the detailed information, such as textbooks and hands-on resources are. There's also a special AMT HOSA email box that's monitored. You can see that here. And I'll share this QR code again at the end of this deck. Another important aspect of launching students into careers is helping them to connect their learning experiences into real job opportunities. Phlebotomy competition can have a direct connection to a career, and here's how it can help students build their portfolio. It's a potential path for students to become certified as phlebotomy techs, which can open doors to entry-level jobs in healthcare. Certified techs can find full-time or part-time employment, which can help them make some money while they continue their studies. And working in the field, students and employees develop relationships with employers, and they can make career contacts for the future. These entry-level certifications can sometimes be a stepping stone to another career in healthcare. There's a lot of opportunities in both in the lab and in the medical areas. To prove competency in phlebotomy, AMT offers professional certification as RPT, recognized by employers for its quality. And if a student wants to learn more about a particular profession, we encourage them to see the profession profiles in the blog section of the AMT website. You can also check out eligibility requirements for certification. If a student does choose to continue down the path of phlebotomy and become certified, we have ample resources to help them succeed. One resource, brand new, is a review course, Fundamentals for Phlebotomy Techs. It has online modules that are created for learners who need to brush up on the basics, so they're prepared to pass the certification exam and also ready to work as entry-level phlebotomists in a professional setting. And here's a sample from the review course. It shows how interactive and engaging the content is. And if certification is a path you choose to go down with your student, AMT does help them get there with a Student Edge program. That's a completely free program that gets students started on their certification journey. It also gives them a sense of what it means to be a member of a national professional association. Whole program is a series of 8 emails that leads them through some quick, fun activities. And everyone who completes the program gets a special Edge completion packet in the mail. Of course, AMT doesn't know who's in your program, so the only way they learn about the Edge is through you. So for them to join, you direct them to the site to sign themselves up at americanmedtech.org/edge. And if you'd like to preview what your students would receive, we encourage you to sign yourself up. So one final summary of who AMT is. One of our AMT strengths and differentiators is our diversity. We have medical and dental certifications, as well as a full set of laboratory certifications. You might be interested in the certification for yourself as allied health instructor. That is a portfolio-based credential rather than a test-based credential. And overall, AMT's diverse membership with varied health certifications delivers a greater versatility and a broader, well-rounded perspective about the skills and knowledge that members can leverage in their careers. And that's what we're about. And I would be happy to answer any questions if there are any.
Mary, I'm checking to make sure. Cindy did have a question. She said, because of the liability with the simulation, be the only way to go, or is there an age requirement for phlebotomy?
So thanks for the question about liability around simulation and age requirements around phlebotomy. And so I'm going to go backwards through that. And so age requirements around phlebotomy, I think that depends on your clinical site. Whether phlebotomist must be 18 to collect a specimen from a live patient. Again, I think that's a clinical site decision. And then with regard to using, I hope I'm answering the question that is asked, with regard to using training arms for venipuncture, I know that certified professionals were helping individual students in our workshop use the venipuncture training arm. I hope that answers your question. And then with regard to HOSA, the guidelines vary, in the HOSA competition, the guidelines vary by HOSA regions. And I know that they have very specific information and instructions on the website. So
Lisa, you want to unmute yourself and ask your question?
Yes, I actually have a couple that I've been typing away. So first of all, in my district, I was part of the one that asked the question about the sticks, because in my district, our students, our high school students, are not allowed to do live sticks. And I know a lot of the phlebotomy training programs require students to have X number of live sticks. So do you have some type of documentation or suggestions on how to approach the school board to tell them that they're antiquated and we need our students to be able to get these certifications, and the only way they can get them is if they do live sticks on people? That's my first question.
So we do have, and Nancy Pudelic may be able to help me with this, or I can actually, I want to give you, we do have a form, an AMT form, that is an instructor attestation that the proper number of sticks have been conducted in order to meet the requirements for certification as a phlebotomist. And with regard to local rules around how that requirement is met, I only know it from a national perspective and what our requirements are.
Lisa, I can help out there, I think. Thanks for that explanation, Mary. So the best way to go about overcoming that is to find a strong local healthcare provider and partner with them and let them advocate on your behalf. I think with the schools, there's a lot of power to be said when they see someone say like, and you're from Florida, so I'll just throw it out there. If you have an advocate in Advent Health or Orlando Health or Baptist, if they're going to bat for you and you have multiple people, in effect, they're lobbying on your behalf. We've seen that happen with several schools throughout the country. So again, get them involved to help you with that.
Okay. Yeah. And is your rule, do you do 18 or 30 or what do you all require?
50 sticks and
okay.
50 and then 10 cap sticks.
Okay.
And as Mary said, all of these sticks have to be validated by a preceptor or instructor and then sent to us where we in turn then review it for validation.
Okay. All right. And then I also asked the question about the dental one, but I was in the process of sending you my email so we can get in touch about that later.
Sure. Great. Thank you for that.
Okay, Mary, I see that we have some questions from Maria's students. So Maria, if you would like to unmute yourself and just ask those.
Hi, my name is Diana. I'm one of the students here. I just had a quick question about which book do you think is the best resource for the TOEFL competition and for the test? For the written certification exam.
It's your choice, whatever format I think you prefer. The competition and the exam draws from both of them. So whatever Ms. Romero is more comfortable with, or Wes Meck, then I'd go with that. But if you're going to compete, it makes sense to incorporate both of them.
Okay. Thank you.
Thanks for the question.
And then we wanted to clarify one thing. Could you just remind us again what the resource was online for the course to review the content of the test and also for the HOSA competition?
We can follow up with Ms. Romero with that information. Would that be okay, right, Ms. Romero?
Yep.
Yeah, that'll be fine.
Okay.
All right, thank you.
Yeah, we'll send that to you. This QR code should take you to the page, and it's all there's americanmedtech.org/HOSA, and then there's also the AMT HOSA at americanmedtech.org email address to a monitored box. Thank you for that question.
I had a question, Mary. This is Nancy, the other Nancy. I understand that there are probably different organizations that offer certification for phlebotomists. Do certain states recognize certain credentials from different organizations, or how would a teacher I know that you gave us that one slide about education and that graphic that you had there, but do you have good advice? Or obviously we know that you feel strongly about your certification for phlebotomist, but I assume there are others out there, and any comments to help us understand or make or just discern the differences?
Yeah, thanks for asking that. So there are a few different certifications for phlebotomy, and there are differences in the requirements. And we at AMT rely on our subject matter experts who are working in the field to help set the standards that we think are appropriate for entry level performance that is competent and meeting the high standards of healthcare providers. So there are certifications that require a fewer number of sticks, and our experts believe that we have arrived at the right level of practice that would meet our high standards and the high standards of the employers who rely on well-qualified professionals to fill the role. So yeah, there are differing standards. One of the things that I didn't mention is that another thing that AMT keeps up to date in our exams is that the standards that our exams are based on we use other standard setting organizations like CLSI for our phlebotomy exam, and our exam is based on the latest CLSI standards. And not every test out there is based on those standards. And the risk of that is that you could be certified as being proficient in a standard that is not the latest standard. So it is a quality measure that AMT relies on for building a good exam to support the highest quality certification.
And would you say that AMT is recognized widespread across the United States? I'm assuming some states don't have requirements, but if a student appeared with this AMT phlebotomy certification, they would certainly have a competitive edge in a pool of applicants. But I just wondered, do you feel that you're recognized in all 50 states?
So it is a national certification, and we have phlebotomists and other members working across the nation. AMT is a well-recognized authority on certification, and there are some CTE rules around states where, in terms of what gets on, I think we call them state lists.
Mm-hmm.
And I believe that AMT's is officially on many of them. Some states have lists, some states don't. But we're confident that employers recognize AMT certifications.
Okay. And students come to you having completed standards to be successful on this exam, but you don't certify programs, right?
Yes, thank you for making that distinction. So educators educate, and AMT certifies. We are an independent third-party seal of approval on the individual that they have met the standards, the entry-level requirements to perform in that specific allied health role, whether it's a phlebotomist or a medical assistant or a medical laboratory scientist. And those education references that I displayed are independent of AMT, and the review course that I shared is carefully prepared. It is a review course, and it reviews what the individual brings to the course themselves. And we are proud of our independence, and it maintains the integrity of a certification, and every person who carries an AMT credential can be proud that they passed a rigorous test.
Thank you, Mary. I had one last question because I always have multiples. And that is, what is the cost? And if I missed that, I apologize.
So the cost of the exam is $125. And in addition to the cost of the exam, we have standalone practice exams that are reasonably priced. And also we are about to launch a new comprehensive phlebotomy review exam as well, that will also have phlebotomy practice exams embedded in it. So stay tuned for that. We'll be sending out some information about that shortly.
I think that may be all of the questions that we have. We're excited that you guys have some new products coming out. I'm very excited about the HOSA competition.